When I came out of the Army, I had a problem with post-traumatic stress disease. When I came out of the hospitals, after a year, I suffered another bout of post-traumatic stress disease with severe depression, anxiety, and fear. And I have what they call nosocomophobia now, which is fear of hospitals. If I have to go to a hospital, I think I would rather die first, because I know they just haven't improved their care. I try to make some of the folks in Connecticut aware that Governor Rell is she's not caring as to whether the hospitals make the reports on how much infection they have, what type of infection they have, how many people are affected by the infections. This law was passed in 2007, and so far it really hasn't come true. They really haven't done what they were supposed to do. I think the initial thing that they should be aware of is the operating rooms. The second thing is the patient areas. I think that when they rewash a bed, and it's just not done properly. I've laid in my bed and watched the other bed being washed, and it's like, it's just not done properly. You know, the same curtains are hung. This MRSA can live for 72 hours outside the body. And it does live outside the body for 72 hours, and that's what the problem is. Doctors with lab coats, God knows when they had them cleaned last, their sleeves, their ties, their stethoscopes, they're just bringing infection from one room to the other, and so are the nurses. I haven't been hospitalized for almost a year now. Maybe they are cleaning up their act, but it doesn't seem so. If 100,000 people died in 2005 and 200,000 died last year. The nurses' aides, the health aides, the nurse practitioners, whatever they are, they're the ones that give the care, and their training is just not long enough. They learn on-the-job training, and they shouldn't do that. You know, especially with the situation the way it is with the infections. And it's not only MRSA; it's C. diff, you know, strep. There's just a whole bunch of things going on, and I would recommend if someone was going into the hospital, a friend or a relative, that they have someone sit with them 24 hours, and just to make sure that you know, the nurses wash their hands and things are just done properly for the patient's safety.